So if you don't have any symptoms, then you don't need any surgery. But if you do have symptoms of pain in the abdomen, particularly after meals, bloating, and sometimes people end up going to emergency severe because of severe inflammation in the gallbladder, then in those situations you will need an emergency gallbladder operation. Sometimes people get pancreatitis because of stones. So that will again be a reason to remove your gallbladder. So if you don't have symptoms, we then leave it alone. But if you do get symptoms, the only treatment is an operation. There's no other treatment which is successful for gallstones. They can't be dissolved by medication. And there is no way we can remove the stones and leave the gallbladder behind because the gallbladder itself is diseased and therefore the gallbladder needs to come out as a whole. So to do gallbladder surgery, we have to put you to sleep. And once you're under anesthesia, we have to make 4 cuts in your tummy, 1 below the belly button and 3 more cuts higher up under the rib cage. We then go in with our instruments and have to clip the blood vessels and the duct connecting the gallbladder to the main tube from the liver called the bile duct. And once we've done that, then we safely remove the gallbladder off the liver, put it into a bag and take it out. Sometimes you may need a washout. And subsequently, we close all the wounds and you're woken up from surgery. You usually stay in hospital for a few hours for observation. And if you're satisfied that you are feeling well enough, then we discharge you to go home. So gallbladder surgery does come with complications and risks apart from the immediate complications, which have a low chance of happening, such as bleeding, infection, injury to bowel or to the bile duct. If everything goes well, some patients develop intolerance to fat. And that's about 1 in 100. Now, if that happens, we may have to investigate and establish that that's the cause and then treat it. And usually some treatment in the form of oral bile salt supplement does help with these symptoms, but you may need this for a very long time in your life.